In the previous sessions, we've talked about the dilemmas faced by public health authorities in choosing what, how, and when to communicate risks. In this session, we'd like to know more about which sources of information you trust and why. During pandemics and epidemics, public health authorities face a number of challenges. When people are stressed or concerned, they're less likely to accept the validity of communication coming from authorities. People often trust international organizations over national health authorities. National authorities are seen as political organizations following their own interests more than organizations acting in the interests of the general public. When people don't trust an organization, they are less likely to follow the recommendations of that organization. People might use different information channels for getting information, like the internet, social media, websites of organizations or leaflets. For example, during the H1N1 swine flu pandemic, public authorities had to face rumors in the media and on the internet talking about a conspiracy between them and the pharmaceutical industries. When people use other ways of getting their information than the official websites, rumors can be hard to handle. Coping with the internet is a fundamental challenge for pandemic risk communication. Many public health authorities have been slow in the process of using the internet and social media. Even if individuals say that they don't find internet-gathered information important, information acquired on the internet can still influence people's behavior. Public health authorities could become better at incorporating social media in risk communication during pandemics and other health emergencies. It could lead to better communication, particularly if the authorities would engage in a dialogue with the public. Public health authorities, experts, and groups in the public might disagree on what constitutes a risk, what information to share, and how to understand it. How to deal with uncertainty is a tricky challenge for authorities. In the early phase of pandemics or epidemics, there's a lot of uncertainty. Communication about uncertainties can lead to an even greater loss of trust, but it might also increase people's trust in authorities as they could become seen as more honest. Risks related to pandemics are complex and can be hard to understand and communicate. During pandemics, the quantification of risk is uncertain and subject to updates as long as data accumulates. Therefore, it's hard to say exactly what the risk is. The important questions the authorities are facing in risk communication are how to be seen as trustworthy, how to use the internet and social media, and how to deal with uncertainty.